Greetings everyone. Myself Dr. Nilesh Kumar Singh, Junior Resident of the Department of Radiologist, IPGMR and SSKM Hospital, Kolkata. To my topic of the paper presentation is the evaluation of the ligament injuries in the patient with ankle and hand foot pain using the MRI. Coming to the introduction, ankle ligaments are frequently injured in a twisting injuries in sedentary individuals as well as in athletes. MRI provides a non-invasive method for the evaluation due to the high soft tissue resolution. Timely diagnosis of the ligament injuries allows the clinician to make up an informed choice regarding the further management. Rationale of the study: MRI studies on the ligament pathologies are limited, as MRI investigation is an expensive investigation and evaluation of the fine ligament structures of the ankle required the good MR images with the thin sections and the good resolutions. Objective of the study: to determine the incidence of the ligament injuries in the patient with ankle and hand foot pain, to determine the incidence of the injury of the individual ligaments and to grade the severity, to study the demographic profile of the affected patients, and to determine the existence of any association between the ligament injuries and the demographic parameters. Methodology: cross-section observational study, Department of the Radio Diagnosis, IPGMR Hospital, in collaboration with the Department of the Physical Medicine and Rehabilitation. Samples as 52. Study timelines February 2025 to November 2025 using the GE Signa SDX T3 Tesla machine using head coils. Inclusion criteria: patient attending a PMR OPD with ankle pain, clinically suspected to have ligament injuries. Exclusion criteria: patients who have any type of metallic implant in their body, patients with pregnancy, and patients with the fractured tumors, dislocation and subluxation of the ankle joint. Now, this is a composite bar showing the maximum number of the involved patients, where from the age range 31 to 40 years. And this is a pie chart showing the maximum involved individuals of the study participants were male. And among the distribution of the BMI, we have the maximum involvement for the patient with the obese class 2. Again, coming to the age distribution, maximum number of the involved individuals were from the age group 31 to 40 years. Among the sex distribution, we have the maximum number of the male involved in our affected patients. Among the BMI distributions, we have the maximum number of the patients were normal BMI patients. Now, this is a table showing the location and the grading of the ligamentous injury. Among the ATFL, we have the maximum number of sprain cases followed by the partial tear. Among the CFL, we have the equal cases of sprain and the partial tear. Among the deltoid, we have the maximum cases of sprain. We didn't get any cases of the posterior talofibular ligament injuries. Again, the composite bar showing the distribution of the ligamentous injury. Among the ATFL, we have the maximum cases of ATFL sprain followed by partial tear. Among the deltoid, we have the maximum cases of the sprain followed by chronic injuries. Among the CFL, we have a maximum cases of sprain followed by the partial tear. We have the pie chart showing the distribution of the ligamentous injury. Among the ligaments, maximum pathologies were sprain, that is 66%. Among the involved ligaments, we have the maximum cases of ATFL injury, that is 57%. Now, this is a line graph for the BMI. As we can see that with the increasing age of the, with the increasing BMI of the patient, we have a higher incidence of the ATFL injury. And in the line graph for age, we can see the maximum number of cases were from 20 to 50 years of age, indicating their higher incidence in the young and the middle-aged individuals. And the relationship between the BMI and the ATFL injury came to be statistically significant with a p-value of 0.04. And among the sex distribution, we have the maximum cases of involvement in that of the males. There's a few diagrams showing the normal appearance of the anterior talofibular ligament. In this, we have the increased hyperintensities suggesting that of the sprain. Again, the axial section, we have the non-visualization of the ATFL along with the fluid collection suggesting a complete tear. We have the hyperintense and a thinned out ATFL representing that of the partial tear. Again, we can see the normal deltoid in the coronal images. And here we can see the hyperintense and the fuzzy appearance of the deltoid. This is a normal appearance of the deltoid in the coronal view. and is a sprain in the deltoid in the coronal view. This is a normal appearance of the cervical ligament, and the figure 10 represents the sprain, high signal in the cervical ligament. And in the figure 11, we have the normal calcaneofibular ligament. And in the figure 12, we have the thickening and hyperintensities of the calcaneofibular ligament, suggesting that of the sprain. Coming to a discussion, 30% of the 52 patients will have the ligamentous injury in MRI. The age distribution of the women was Gaussian, with the maximum number of participants were from 31 to 40 years of age. The proportion of the affected patients were to be higher among the male participants. ATVL was found to be a most commonest ligament to be involved, followed by deltoid, followed by calcaneofibular ligament. Among the pathologies encountered, sprain was found to be the commonest, followed by the partial tear chronic injuries. We didn't get a single case of a posterior tibiofibular ligament or interosseous talocalcaneal ligament pathologies. For correlation with the age and the BMI, ATFL and deltoid were used as these two were the most commonest, were among the two commonest involved ligaments. Significant association was found between the ATFL injury and the BMI. Our findings agree with the previous study done by the Budia et al. And Karat et al., which found that the ATFL injuries were most commonly injured, and Gwendolyn, Wuberg et al., who found that the weight and the BMI are the risk factors. Limitation of the study. MRI studies were not corroborated on the arthroscopy. Now the conclusions. Ligament injury is the commonest among the young adult male. The ligamentous injury comprise 57-80% of the cases with the ankle sprain. Commonest injured ligament is ATFL. Now coming, I would like to immensely thank Dr. Mulibrata Sarkar, Senior Resident of the Department of Radiodiagnosis, IPGM and SSCM. I would also like to thank my colleagues in the Department of PMR for referring the patient for MRI. And we would like to thank also the medical technologists in our team in our department for carrying out the MRI examinations. I would also like to thank my patients who consented participate in the study. Thank you. That's all from my side.